What's up, guys? This is Brad at No Nonsense Medical, where our goal is to communicate and inspire authentic discussions in the medical profession and lifestyle. Today, I want to take some time and talk to you about working in emergency medicine, some of the pros and cons, advantages, disadvantages. But before I do that, let's talk a little bit about the history of emergency medicine. By the way, if you want to get a awesome understanding of the history of emergency medicine, there's a documentary called 24/7 365 that I will post a link to it in the show notes. It's great. Now, as far as back to the history of emergency medicine, it's really not that old of a specialty. Just in the 50s and 60s is when it slowly started emerging into what we know now today as the modern day emergency room. Used to, emergency areas or emergency doors, access areas that hospitals had were not really existent. Finally, in the late 60s, um, there was an organization formed called ACEP, ACEP, and it shortly, a few years later, was able to form an actual emergency medicine residency so that doctors could actually get a dedicated emergency medicine training. Prior to this, there were medical students and residents who ran the emergency care areas. So you had the least trained providers dealing with the sickest people. This blows my mind because, back in the day, people would have to see their general practitioner for everything. If you got in a car wreck, you didn't go to the emergency room. You went to see your family practice doctor. Even if you were cut and you needed sewed up, you had to call them, and if you weren't able to get a hold of them, then you just had to wait. They didn't have many options because back then the people that filled up the hospitals were people who their general practitioner admitted them to the hospital, or a specialist did, who the general practitioner who had referred to them anyway. But anyhow, the big push for this that got everything organized in emergency medicine has been great in giving people quick access to emergency care. I'm really glad that this was formed because it gives me a extra form of security and comfort knowing that if my friends or family were to be injured, that I could take them to a place in an emergent setting and they could get care right then and there that they need. All right, the advantages of working in emergency medicine. There are such a wide variety of people who have different religious and cultural practices. Some of them don't want blood transfusions. Some of them will only take certain types of medications. Some of them won't take any medications. And then sometimes these patients will come in and they'll have these rare diagnoses, or they'll have diagnoses and they don't know what they are. They'll come in with medications A, B, and C and say, well, I don't know why I take these medicines, but I take them for my high sugar, my diabetes, or my high blood pressure. And then you slowly start putting these pieces of this puzzle together to try to figure out this choppy history that they're giving you, what exactly is going on with them right then and there. So you really have to have a very good understanding of a wide scope of medicine, and it can be quite the clinical challenge and very interesting all at the same time. Now, I think that emergency medicine plays a very crucial role and is the center of healthcare. You could debate that, but it's definitely one of the major cornerstones of healthcare because, like I was saying before, used to everyone came to the hospital through their family doctor, but now most of the patients that end up in the hospital, they're placed there after coming through the ER and being evaluated and then being admitted to the hospital. Now, one of the great parts about working in emergency medicine is that if you work in a larger facility, you have access to specialists that are on call that can answer your questions what to do with a certain orthopedic injury, or someone who may have had a stroke, or a person who looks like they might have appendicitis, but they, um, don't want surgery. On the other hand, if you're in a smaller facility, or maybe not a larger or large enough facility, you can always transfer your patients to a higher acuity facility, and that's a huge advantage. That way, you are able to practice within your scope of medicine, that you're not having to treat people for medical conditions or injuries that are outside of your comfort zone and abilities to practice. Now, one of the advantages of working in emergency medicine is that there is not supposed to be regular follow up. But sometimes there is, because sometimes patients will come back over and over, even though you've counseled them several times that they really need to follow up with a certain specialist or with their internal medicine, family medicine provider. Another advantage of working in emergency medicine is time management. Once you clock in, you're there, you're working, and then once you leave, you're done. You're not on call, you don't have patients calling you. Alright, some of the disadvantages of working in emergency medicine are long shifts, and that includes nights, holidays. The shifts can really stack up, especially if you're working a pretty tough shift, and then you have to be back on your next long shift not too long afterwards. So, working in the ER is definitely a high tension environment, and you really got to have thick skin to work in the emergency room, or it's going to be tough to stay there for long. Sometimes there is a lack of organizational support at different facilities. Sometimes you may not have all the right supplies that you need, or there may not be any specialists that you can refer to. You may have limited staff that day due to flu season or any kind of number of delays in care. Another big disadvantage of emergency room employment is that you can have pretty aggressive and difficult patients. Sometimes patients come in there and they have mental health issues, and they're super high, or just people don't understand what's going on with them, or they have a communication issue, and things can get escalated quickly. So in the ER, there's usually some form of security or law enforcement close by. There's definitely an area of abuse in the ER, and that goes for not only the employees dealing with these aggressive or difficult patients, but also the ER gets abused quite a bit, because sometimes patients, especially if they don't have to pay for their own medical care, will just come to the ER anytime they have any kind of complaints, even if they've been there sometimes even several times the same day. A big disadvantage of working in the ER as far as seeing people with social issues. Now, a lot of ERs, if they're bigger, they do have case management and information for resources to help these type of people, especially people who don't have medical insurance to get the care that they need, or even people who are very indigent and they don't have a way to get back and forth to the appointment that they need to go to, even if their health care is already being paid for. One of the biggest disadvantages of working in emergency medicine is having to see people's friends and family cope with the pain, suffering, or loss of loved ones. Being in emergency medicine, you frequently encounter activities where patients don't always have the best outcomes, but that's part of emergency medicine. Another big disadvantage of working in emergency medicine is that a lot of times that the friends and family of the patient that you're treating, they have no idea, and that they don't have a way to know, to acknowledge the amount of effort that's been put in. And an example of that is a patient down the hallway, let's say that they've asked the nurse 4 times for a blanket, and they're upset, and their face is red, and they're fighting mad because their mother's freezing, and they've asked you for a blanket several times. But then down on the other end of the hall, there's a patient that they've been running a code on for the last hour, and they keep bringing them back, and they keep dying, and keep bringing them back and dying. Those kind of things happen all the time where you can't share that information with patients, but um, it goes unknown and unacknowledged a lot of times, the amount of effort that you're putting in to help the more sick patients. As far as the qualities that are needed to have a long-term emergency medicine career as a healthcare provider, you have to have a really good level of understanding, and you have to have thick skin. You've got to be able to have a good sense of humor, and to not always let things get to you personally. You have to be able to be compassionate, but you also have to learn to be able to turn things off, because if you are being too compassionate with in a certain scenario, and then a trauma comes into your emergency room, you have to be able to kind of mentally turn things off sometimes and think what's your most important task, emergent task to do at that time. You definitely have to be able to work under high pressure. That's definitely a must. And you've got to be able to roll with the punches, as they say, and be comfortable with regular changes, because there may be different radiology staff on, different radiologists, different providers you're having to work with. There may be a shortage of supplies. There may be a shortage of multiple staffing positions. All in all, I think that emergency medicine is a great field to work in. It's a great place to see a wide variety of different scopes of medicine. Alright guys, thanks a lot for watching my video. Please hit the like and subscribe button. Thank you very much.